Hi guys, this is Dr. Nick here. Today we're going to look at the Sensitiv Imago once again, but this time we're going to look at a cool program that it has on it, which is the anti-smoking program. So in this video, what I'm going to do, I'm going to showcase what the anti-smoking program looks like and what it actually does. But in simple terms, what it's supposed to do is help support somebody to quit smoking. So when it becomes difficult and we need the extra support, this might be a helpful solution for you. So I hope you enjoy, and thanks for watching.
Hi guys, this is Dr. Nick here again. Today we're going to look at the Sensitiv Imago, and we're going to look at one of the specific therapies that it does, which is very unique. It's an anti-smoking therapy. So I've already done a little scan here to showcase it, but what we would choose specific organs of the respiratory system and then scan them for that patient who has an addiction to nicotine and to smoking. And then what we would do, we would go into this anti-smoking button here, as you can see, click on that, and it would show all the organs. Now we've already done therapy for this individual, but beforehand what we would do, we would see here just the regular organs here, and we'd look for the worst organ or the lowest coefficient. So in this case, before we started doing any frequency compensation or BRT therapy on this patient, their lowest organ was the chest organs in general, and it was specifically 84.9. So what we would do with that, we would choose that organ, and what we would ask the patient to do in order to help them quit or desensitize them to smoking is to actually smoke their last cigarette, say a half an hour before they come in, and then don't smoke it all, but just burn it a little bit, and then after that, put it out, put it in a plastic bag, and then spit in the plastic bag, and then bring that with them. I know it sounds disgusting, but we want their saliva and we want the nicotine or the specific cigarette that they smoke, so we can help create support for them to quit the habit in general.
Okay, so for the part where the patient has to smoke the cigarette before they come to do the anti-smoking program in terms of trying to create a specific medicine for them that will support them during the quitting phase, what you have to do is this. So I don't advise this, of course, but right here we have the cigarette. Theoretically, they've smoked this now, and then what they've done is they got a plastic bag, put the cigarette in the bag, and then they spit inside the bag, closed it up, and then came to the office to start the actual treatment. Well, first assessment, treatment, and then making of the medicine. And then, as we talked about with BRT, it's very similar in terms of where we would do 10 sessions of a BRT type treatment towards the respiratory organs and utilizing this physical medicine that we would make with our technology. So I hope that makes sense overall, but keep watching the video so you can see what else we have to do.
So once we do that, we then do our scan, as we always do in general, of the organs that are specific to the respiratory system that hinder or affect smoking most directly. And then, like we said, we find the weakest organ within that in the respiratory system with the lowest coefficient. Then we click on here to make a specific preparation for the individual. So we would take their saliva, we would take their physical cigarette that they've half smoked, and we would put it in the input cup, which is the N transfer on the external machine, and then from there we would use, say, our granules. We would click this, use granules in terms of sugar granules, and with that we put that into the output cup, which is the S side of the external machine, in order to then create an inverse signal, as we're doing here with the inverse button, and press start to create the medicine that will support them to get off smoking. So what we do, we'd press start here, kind of thing, and you would see it going back and forth in order to be able to make that medication. We'll stop it for a second. But once we make that, then we can physically test the dose against them, as we did in previous videos, as you have seen before. So once we know the specific dose, what the person can do with those now newly made granules that are specific to their saliva and to the nicotine and cigarette that they always used or always smoked is that whenever they have a craving, they can actually take the specific dose that we figured out for them to help suppress that craving, to ameliorize it at that moment so we can start to break down that habit. And then, of course, during that time frame, the most important part, which we see here and we've seen in previous videos, is to do BRT on those specific organs, especially the respiratory organs, because we want to help detoxify those organs which have been toxified from smoking. And of course, systemically, there's many other issues with smoking. But in general case, we would want to do a BRT cycle, at least starting off with one cycle, which is 10 therapies, as we said, 10 treatments of BRT with frequency compensation to support the respiratory system while they will be taking the physical granules in between to ameliorate themselves of having a cigarette when they have those acute fixations for it. So that's what we can do overall, and it has been seen to be successful in the past, and that's why it's something that can be used to support the individual going forward when they truly want to stop smoking, but it's difficult for them. Because of course, with any kind of addiction, it's very difficult to quit something if you're not willing to quit. So in this case, when somebody's really willing to put the effort in to quit and they need that extra help and support, then this anti-smoking protocol from the Sensitiv Imago can be very helpful to do that. And it might take 1 or 2 up to 3 cycles of BRT to fully get the person out, but it has been seen through different practitioners and doctors utilizing this for their patients when it comes to quitting smoking. So I hope that gave you a little bit of an insight of what else the Sensitiv Imago can do and how it can support somebody in addiction, especially for smoking, which is the specific protocol that it has here, in order to finally quit that habit.